I was just watching online here, and a friend of mine down on the South Shore posting a picture saying, at outpatients today, outpatients, emergency departments. Same diff. But if you don't have a family doctor, outpatient sounds like, well, I'll just zip in and I'll be right out. Not quite. Healthcare was a top-of-mind topic for many reasons these days. We started our last conversation talking about money and how that graduated to a conversation about the healthcare system. So we'll start off this conversation as we reach the leader of Nova Scotia's New Democratic Party, Gary Burrill. Gary Burrill, your thoughts on yesterday's announcement by the province about this $244 million that apparently we didn't know was coming?
I'm very pleased to see that we're going to have a major infusion of money towards improving the situation in rural internet. We know that this requires investment. I think this is an important. If we've got a windfall, this is a very good place to direct it. But there are other things about the announcement that are less clear. For example, there's $18 million there that's allocated in a healthcare direction, but there's no indication of what's in fact being done with that. I think that the public would like to know, with all the wide range of healthcare needs we have at the moment, if an end of fiscal year one-shot pile of money has become available, and some of it is to be directed to healthcare. I think people would like to know which part of the healthcare crisis and how it's going to be addressed to.
Gary Burrill here with us. What about the thought that, if this is money we weren't expecting, maybe paying down the debt makes sense, and then there's more money in future budgets that won't be going towards just paying interest?
Well, that's something that governments in the past, with money that has come from the same source, have done. I don't think the arguments are very compelling in favor of doing that at the moment. At the moment, what we desperately need in Nova Scotia are investments. We need investments in healthcare. We need investments in young people's opportunities. We have the fastest rising tuition anywhere in the country. We have young people graduating with average $40,000 debt. We certainly need investments in income in Nova Scotia. We've got the worst child poverty anywhere in the country. So in my view, this isn't a very good time at all to think about paying down the debt. It's a good time rather to be making the investments in our population that we need.
We're speaking with Gary Burrill, the leader of Nova Scotia's New Democratic Party, and next week is Budget Day. I was a little surprised yesterday this announcement came out just so soon to the actual provincial spending plan. You and your party released today, patient care being affected, healthcare crisis must be addressed. You speak to us about a Deirdre McPherson. What can you tell us about Deirdre?
Well, Deirdre's case brings to light a number of the things which are so difficult and problematic in the healthcare system at the moment. In her situation, she went to the hospital. It turned out she had double pneumonia. She went to emergency because she doesn't have a family doctor, for one. So that's the first thing. We've got over 100,000 people unable to access primary care, having to go to a walk-in clinic or to go to an emergency room. Our emergency rooms, as a result, are often plugged up and wait times are very long. So that was the first thing. The second thing was, when she was diagnosed, they said to her that they would like to admit her, but in fact, if they admitted her, they would have to place her on a stretcher in a hallway because there was no room for her. And then she opted, because in her family there are people with medical experience, to go home rather than be placed on a stretcher in the hallway as a hospital patient. And then, in fact, that didn't work out, and she had to come back. Well, one of the reasons we find this overcrowding problem throughout our hospital system is that we know that there is about a fifth of the beds in our hospitals in Nova Scotia are being filled at the moment by people who aren't hospital patients. They're being filled by people who are actually residents of nursing homes who are waiting for a nursing home placement. But because the government hasn't invested 2 cents over the last 5 years in opening a new nursing home bed, quite literally, they have not opened a single nursing home bed in the last 5 years. Because that's the case, so many people are waiting taking and resident in our hospitals, that when people, many of whom come to emergency because they don't have a doctor, when they need to be admitted, in fact, there's no place to put them. So this is a systemic problem. People don't have access to a doctor. The emergency rooms are overcrowded. The hospitals are overcrowded because the investments haven't been made in nursing homes. And it brings to sharp light the question that the budget next week is going to raise. Is the government going to make an investment in opening up new nursing homes so that we are, in fact, able, when somebody has to be admitted to the hospital, we're able to say, yes, we'll admit you to the hospital, and here's the room that you'll go in. At the moment, many people experience like what Deidre McPherson experienced, is we will admit you, but there is no place in the hospital that you can go. We'll put you outside the pop machine. We'll put you beside the ice machine. We'll put you in the corridor. We'll put you in the hallway. We'll put you God knows where. But this is not an effective system, and in order for us to surmount this, the government needs to make a serious investment in opening up nursing homes in the province.
Gary Burrill, the NDP caucus, Premier must release code census information. As we heard, backlog of ambulance and paramedics unable to get patients in. We're told it's because of the demand on the emergency department. What do you think we would learn by having that information?
Well, the previous system was that when the emergency room became so crowded that it was unsafe, staff there would call code census, and that meant that throughout the hospital, room had to be made for them to discharge patients from the emergency room into the rest of the hospital. So staff a little while ago were no longer allowed to call code census, and what the union of people who worked in hospitals asked was simply to say, all right, we don't know how often code census is called anymore. We're not allowed to call code census, but tell us how many days in the year are we in a situation where we have such overcrowding in the emergency room that under the old rules we would have called code census if we had been allowed, and they won't tell them. And of course, they don't want to tell them because the numbers will be damning. Because we know from many indications, including the number of our paramedics and ambulances that are tied up waiting for patients to be attended to at emergency rooms, that our emergency rooms in many parts of the province are clogged solid. So this is a basic information that the union has asked for. I think it's very reasonable on their part. We have to have a picture of what is actually happening. There's nothing to be gained by the government being secretive about this. But we're in an odd situation in Nova Scotia. Our Nova Scotia Health Authority is the only health authority in Canada that meets behind closed doors, that no citizen is allowed to go to its meeting. No citizen can get a copy of the minutes of its meeting. So there is a lot of super centralized secrecy taking place. You never improve a system that doesn't work with super centralized secrecy. You have to open up the doors. You have to open up the curtains to see what's going on. You have to be able to measure it, figure out what your goals are, how much you want to improve by which date. All of these things require information and they require openness, and these are the things that at the moment in the healthcare crisis we haven't got enough of.
I suspect we'll be hearing more about this as the legislature resumes after the break next week, Budget Day Tuesday. Gary Burrill, thank you for being available to us today to tell us what these two news releases were about and what's on the top of your agenda for the back to session.
Oh, that's my privilege. Thank you.
Take care.